If you can't control your bowels or your bladder and you have low back pain, I'm going to be very, very worried. A loss of bowel or bladder control is what we call a warning sign, especially in the context of low back pain. That goes for the same thing as like urinary retention. You're not able to go, as well as not being able to control your bowels or bladder. Guys, that is a big deal. Also, along those lines, I worry about something called saddle anesthesia. This is the idea that your pelvic area becomes numb. You can't feel it as well. That, no matter when, is a problem, but certainly in the context of low back pain is especially a problem. And then weakness in the legs. If your legs are weak and you have low back pain, I'm worried as well. All three of those symptoms together or separately could mean that there is a problem with your spinal cord as it relates to your low back pain. And that is potentially an emergency. Guys, there are lots of other warning signs and red flags. We are going through those right now. Also, let's say you have a history of cancer. Whether you have cancer right now or you had cancer in the past, this is something I'm really concerned about if you have low back pain, because one of my fears is going to be that the cancer has spread and traveled to your spinal cord. That's a big deal. Also, if you have a history of trauma, you got into a car accident, you fell down a flight of stairs, somebody hit you hard, whatever the case is, if you've had a history of trauma in addition to low back pain, that's got to be evaluated without question. Also, if the pain is severe, and I know you guys might be saying, well, yeah, duh, if it's severe, I'm going to get to see. No, you'd be surprised what people are able to tolerate. Severe pain and or pain that's getting worse or simply won't go away, either of those separately or together is basically means you gotta see your doctor. Also, unexplained weight loss with back pain. I mean, honestly, unexplained weight loss, no matter what, I always care about. We don't want you losing weight for reasons that cannot be explained. But if you're losing weight for reasons that can't be explained and you have low back pain, I mean, that's just a double whammy. You certainly should have been seeing your doctor, but you definitely should now, okay? Back pain that wakes you up in the middle of the night. Shoot, anything that wakes you up in the I don't like things that wake you up in the middle of the night. Abdominal pain, back pain, not crazy about that, but certainly back pain, definitely. Also, if you have back pain, but you also have associated fever or other signs of infection, we worry about severe infections that could have traveled, infections in different parts of your body, abscesses, all sorts of stuff. We really don't want that. That's got to be seen. And did I mention numbness and tingling? I know I did in the beginning of the video, but I'm going to reinforce this now. Numbness or tingling in your lower legs in the context of back pain just always needs to be evaluated. You know, guys, there are other warning signs, red flags when it comes to low back pain. These are a few very important ones. I always say, you know your body best. And if something does not seem right, you need to see your doctor. And in fact, this is what I would do. If you're someone out there with low back pain right now, or you know someone who has low back pain, by the way, share this video with them. But touch base with your doctor, even if you think you know what's going on, to make sure you know what's going on and that you're being treated and managed appropriately. That's really the best and only surefire way to go. Guys, I'm Dr. Jen Caudle. Please subscribe to my channel on YouTube and click the little bell for updates. Guys, I hope you don't have low back pain, but if you do, make sure that you're diligent, you are vigilant, and that you are seeing your doctor to get a proper diagnosis.